This is the daughter of an 80-year-old man suffering from Alzheimer's. A decision had to be made regarding a brain tumor. The daughter believed that surgery would be significant, but the patient refuses surgery and accepts his destiny.
I'm Dr. Hayes Whiteside, Chief Medical Officer and Senior Vice President for ProAssurance. Is informed consent the act of a patient showing up for a procedure or treatment as one physician suggested? Absolutely not. Is informed consent a signature on a hospital consent form? No, it isn't. State laws vary as to what standards apply, but regardless, think of informed consent in this way. It is a process with several important components. The consent process informs the patient, it protects the physician, and it should contemplate the following. It is an educational process where your diagnosis and the pros and cons of various treatment options are discussed, as well as giving the patient an option for doing nothing and what those consequences would be. Include in your talk the most serious and the most common side effects and complications, even if you've never had one. Also give the patient the potential benefits of any treatments that you may suggest.
Mental capacity is the ability to make decisions and understand their consequences. People are allowed to make reckless decisions as long as they don't break the law. In the past, people with the best of intentions have decided that because someone is old or has learning difficulties, they are not able to make decisions for themselves. Firstly, capacity is assumed unless proven otherwise. Secondly, people should be helped to be able to make decisions for themselves. Thirdly, people are allowed to make unwise decisions. Fourthly, decisions made for people who lack capacity must be made in their best interests. And finally, decisions made in patients' best interest should favour the least restrictive option for the patient. How do we determine whether or not she is able to decide? She must be able to understand and retain the information long enough to weigh it, make a decision, and communicate it to us. If she is able to understand, retain, weigh, and communicate her decision, then she has capacity.
Whether someone has capacity is really influenced by two things. Number one is the significance of the decision, and number two is the cognitive capacity, the cognitive skills involved in the capacity of making that decision. So these are directly related. If the decision is more complex or more serious, having a greater impact on the person, that's going to require a greater degree of capacity. It's not absolute. It's not that someone does have capacity or doesn't have capacity. It's relative to the decision being considered at the time. And it's also not related to a diagnosis. Just because someone has a diagnosis of dementia or Alzheimer's disease doesn't mean that they don't have capacity to make decisions. It all depends on what their cognitive skills and abilities are to be able to understand and analyze information and make the decision.
As everyone is bound to need health care at some point in their life. For patients to be autonomous, they must give informed consent and be competent or have the correct mental capacity. The stakeholders or patients should have an honest and open relationship with their physician. Rather than complete medical paternalism or extreme patient autonomy, medicine should be practiced in the middle ground. A shared decision, complete with a full and frank discussion of risks and benefits, is more likely to ensure a positive patient experience and outcome. Thus, the decision should ultimately be that of the patient, but with familial and physician intervention.